What if there were a way already unfolding in this country to improve the care for patients like my daughter Morgan? This is one single year of Morgan's medical record. The different colors represent the different types of doctors that she's seen. You can imagine how much this has multiplied in the 10 years since her diagnosis. Let's go back in time to the time when Morgan was 11, about 10 years ago, and imagine that you are her doctor. You likely only have access to part of that information that I just showed you because data is stored in different silos at individual providers and health systems. If you do get extra outside records, you usually get them in that format I just showed you in paper, and you have to flip through hundreds or thousands of pages to try to find the important nuggets of information that you need. If you are lucky enough to get them in a digital format, you usually get them from America's favorite medical device, the fax machine, which that does get them into digital format and on a screen to review, but you still have to flip through those pages to try to find what's important. And it's easy to miss information. So not having the necessary information causes delays in diagnosis, misdiagnoses, burden on the patient and family, and stress on the doctors and nurses. Delayed treatment was published in the Journal of Clinical Medicine and was found to cause 3 to 5 times higher expenses when treatment is delayed for patients with autoimmune disease and cancer. And tests are often duplicated in our system, often because the provider just doesn't know the test was done or they don't know where to find the results. A study by the University of Connecticut found that 27% of tests are duplicated. That's 1 out of every 4 needle sticks or painful or stressful procedures that patients have to go through when it wasn't even necessary. And when you think about chronic disease accounting for 75% of all healthcare spending, you can see that these are important problems to solve. So today I'm going to tell you a little bit about our journey and some of the challenges we've had and how those challenges have inspired me to dedicate my career to making it better for patients like Morgan. While we've encountered a lot of really bad patient experiences, and those are really important to solve, I also think it's important to solve the experience challenges for doctors and nurses. Despite the fact that they had poor technology and were missing data, the expertise of Morgan's doctors are what's kept her alive, able to go to college, and to be here today. It also puts a tremendous burden on the patient and their family to remember and retell their medical history over and over again. Think about a doctor's visit and all those clipboards and forms and questions you have to ask and answer. How well that happens is largely dependent on how well the patient can remember and communicate that information. If they fail, their care suffers. We must remove that burden. Today I'm going to talk to you about 2 different problems that affect both patients and providers. And I think if we can find solutions to these, we can improve the clinical care and the experience for everyone. The first problem is that providers don't have access to the data they need because it's stored in these different silos. As you can see, Morgan's information is scattered across 6 different health systems. This means that they likely don't have access to the information that they need to adequately diagnose and treat her. The fact that this information exists but is not available at the point of need, at the point of care, is a terrible waste of the provider's time, training, and years of experience. So let's go back again to when Morgan was 11 years old and in your office, and you're trying to figure out what's wrong with her. You listen intently to the story that Morgan and her mom tell you. She was an active child, has been a competitive gymnast and cheerleader. She started having all these strange symptoms: 3 broken bones, 3 cases of strep throat, frequent stomach aches and headaches, extreme fatigue. She started losing all of her gymnastics abilities and her tumbling, and she ended up to where she can't stand up off the floor or walk up the stairs. You really want to help solve this problem for her, from her symptoms and from all of her past medical history, but you don't have access to the medical records from the urgent cares, from her pediatrician, from the emergency rooms, or the orthopedic doctor. And despite the fact that she saw all of these doctors who had great clinical skills, their technology failed them and Morgan. Her diagnosis was missed for 1 year and 3 months. That's 457 days that her disease was causing damage in her body without anyone trying to slow it or stop it. 457 days. So on a fluke, her dermatologist ordered a biopsy of her skin because they wanted to get insurance to cover a laser treatment for her rash. And that biopsy happened to come back with our answer: juvenile dermatomyositis, a rare, life-threatening autoimmune disease where the body attacks its own cells and tissues. The symptoms of this are muscle weakness, rashes, severe fatigue, sun sensitivity, GI symptoms, heart disease, and lung disease. Every day that a child goes without treatment is a day that damage occurs. And the more damage that occurs, the harder it is to treat. And because of this, we've known several children who have died from this disease, including our close friends. And I tried to help after her diagnosis. I started carrying around these mom binders, as I call them, with all of her different records, because I was terrified they were going to be missing some important piece of information. And I remember thinking at the time she was diagnosed, if a doctor had seen all of these visits and activity on one single screen put together, they probably would have wondered why this 10 or 11-year-old is going to the doctor all the time. And maybe that would have sparked a faster diagnosis, and maybe today she would be in remission instead of in active intensive treatment 10 years later. I'll often wonder if that impacted her recovery. The second problem is that care is not coordinated between doctors, nurses, patients, their families, the physical therapist, the home health nurse. All of these people are involved in the care, but they don't have one single consolidated view to see what's getting completed and what might be getting missed. And according to the World Health Organization, just 50% of chronic disease patients take their medication as prescribed, and as much as 20 or 30% of prescriptions go unfilled completely. And many studies have shown that up to 30% of appointments are missed, and these missed appointments and treatment can cause worsening symptoms, hospitalizations, or even death. As Morgan goes through the health system, we find that she gets a long list of to-do items at each visit that we're somehow supposed to accomplish. And this is some examples of her first 3 months of diagnosis. You can see this is a lot of information for us to remember and get accomplished with a sick child getting used to a new diagnosis. And all of these doctors don't have a way to see what's happening with their own orders, much less what's happening with all the other providers that are seeing her. Despite the fact that Morgan gets a lot of medical treatment, she still spends 99% of her life outside of the healthcare system trying to be a normal college student. She sees a lot of care. When I mean a lot, she takes 21 pills a day, gets admitted to the hospital once a month for infusions, sees 12 doctors in 6 different health systems in 3 states. She gets regular tests like MRIs and lab tests, physical therapy evaluations, bone density exams, and lung function tests. And that's a lot of information to try to remember, and it's really easy for us to miss important things. I was horrified when I realized that we had missed important tests like MRIs, and we'd forgotten to adjust medication dosages after a visit. You'll never know if that had an impact or not. We've tried to use the 23 patient portals that she's been given, but these also don't give us a consolidated view, and they often have conflicting information, so we're not sure what to do. They really haven't worked for us. So you might be thinking, this is an extreme case. This doesn't happen that often, but it's more common than you would think. 10% of patients in the US have a rare disease. That's 30 million people. 2/3 of people over 65 have 2 or more chronic conditions. And in the US alone, there are 2 million new cancer diagnoses each year. I'm sure all of you know a family or friend that's had some kind of serious health condition. You can imagine that I've been pretty motivated to try to solve these problems for Morgan, for our family, and the other Morgans of the world. First, I co-founded a care coordination company to help patients navigate the healthcare system. And then about a year ago, I joined the U.S. Digital Service at the White House and have been working in partnership with Center for Medicare and Medicaid, or CMS, on these very problems that I've talked about today. And one thing that I've learned about joining the government is you get to work on really cool problems that affect all of Americans. The project that I've been proudly building is called Data at the Point of Care, and it enables providers to ask for and receive the medical information that Medicare has on their patients. And Medicare gets this information through claims that doctors submit to get paid for their services. So if Morgan were a Medicare patient and all of her doctors had data at the point of care, they would get regular updates on her diagnoses, procedures, medications that are filled, and preventive health items. And this gives a high-level view of her recent and past medical history and can also give them some view into what items have been completed. So as an example, if Morgan's doctor ordered an MRI and she went and had that MRI, all 12 of her doctors would be notified that she had had the MRI, which provider had done the test, and what their digital address is so they could reach out and get the results. And all of this happens without the patient having to do anything. It can be done in between visits. And if Morgan forgot to get the MRI, or her mom most likely forgot to schedule it, then this can help the doctor know it wasn't done, and a nurse or care manager can reach out to see why the MRI wasn't done and to see if they can help. Often patients don't get tests like this because they simply get busy and forget, or they're not sure if they can get it scheduled during their convenient time frames, or maybe they're worried about the cost or whether it's really necessary, or maybe they just don't have a ride. So oftentimes a nurse can reach out and make an impact and help them overcome these challenges. And then when patients can get this treatment, they can get earlier diagnoses and treatment before problems spiral out of control. So essentially, this project is giving doctors that single screen that I really wish her doctors had had to be able to diagnose her faster. The Data at the Point of Care project is a pilot project, and we're just getting into production in this month. We would love for doctors to join us at dpc.cms.gov, where you can request access, and I'm so excited to see how many Morgans we can help. But that's not all. Medicare is not only committed to giving this to the providers, but they're also making sure that patients and their families can have access to the exact same information that their doctors do through the Blue Button Project. The Blue Button Project allows patients to download apps that are built for them, and then they can authorize Medicare to give their claims data to that app. And this allows patients to have their information with them all the time, whether they're at a doctor's visit, traveling, or an emergency situation. So my ask of you today is, first, technology and healthcare experts. The government needs your help. Consider joining. I'd always worked in the private industry, and I guess I just kind of always assumed that other people would take care of these government big problems. But I found after a year that nobody else is coming. It's up to us to solve these problems. Patients, get a copy of your information, both your claims data and your clinical information from your doctors. You never know when you might need it. Patients, ask your doctors to join the Data at the Point of Care project because they need to know that this is important to us. Doctors, demand that your IT vendor or EMR vendor put this information into your tools and put it in a way that it's easy for you to use. And patients and doctors and everyone, ask your insurance company to provide something like Data at the Point of Care. We've created this project in open source, so there's code available to get you started, and it's built on healthcare standards, which makes it easier to implement. The technology is here, and the data is becoming available. You heard about Morgan and her 457 days. The problems that we have talked about today can be the difference in life or death. Don't let this happen to you or your family. Join me in demanding that the healthcare system use the technology and the data that is available today. We must do better.